Hello.
I'm sorry, I was taking a nap.
It's okay. My name is Ahmed Kareem, and I'm your student nurse today. I'm just gonna wash my hands and put on some gloves. Can you confirm your name for me, please?
Rachel Williams.
Okay. And what is your date of birth?
June 27th, 1991.
Okay. Do you know your medical record number?
I do not, but
You
it's
do
on
not.
my wrist.
Okay, so let me come over here and check. So we're gonna compare it, make sure it matches the chart. So your name, date of birth, and your MR number do match. All right, thank you. Next thing, do you have any allergies to any medications, food,
No.
latex, anything like that?
No, I do not.
Okay, perfect. So no allergies. Let me check the chart, and it seems like we don't have any allergies down for you. Perfect. Next thing I'm going to do is check your vitals, and I'm going to look over here on the monitor, see what your blood pressure says. So it reads 120/80, which is perfect. That's normal. And then your oxygen saturation is at 96%, which is also normal. So I'm going to come over here and take your pulse, if you don't mind. All right. And your pulse rate is about 84, which is normal. And then your respiratory rate was 16, which is also normal. And then the next thing I'm going to do is check your temperature. I'm going to put the thermometer under your tongue. We'll keep it there until it beeps. All right. It read 97.8, which is normal.
Awesome.
All right. So, do you have any pain?
Yeah, in my left hip.
Your left hip. How long have you had that pain for?
About 4 days now.
Okay. Is it in front of the hip, or on the side, or towards the back?
Like on the side.
Okay, so about 4 days. Is the pain there all the time, or does it come and go?
It like comes and goes.
Comes and goes.
Yeah.
What makes it worse?
Like walking and
Walking
running.
on it. And then what makes it better?
Just rest.
Just rest? All right. Have you tried to use anything for that pain to see if it helps?
Yeah, I take some ibuprofen maybe
Okay.
twice a day.
And then what would you rate the severity of the pain if I told you on a scale of 0 to 10, 0 being no pain, and then 10 being the worst pain you've ever felt in your life?
A 3.5.
Okay. All right. So the next thing I'm going to assess is for level of consciousness. So the patient looks to be not in distress, looks comfortable sitting upright in the bed. And then, do you know what day it is today?
Yeah, it's Saturday.
It's a Saturday. Do you know if it's a morning, or it's a noontime, or it's an evening time?
It's like dinner time.
Dinner time. All right. And do you know who's with you today?
Yeah, my mom's with me.
All right. So the patient is conscious, alert, and oriented to place, person, and time. All right. The next thing I'm going to do is check your equipment, make sure everything is functional. The first thing we're going to look at is your oxygen mask, and I'm just going to look around and make sure there's no breaks in the skin, there's no redness, there's no signs of any irritation, which everything looks good. I'm going to come over here and look at the oxygen line, and there are no kinks, and it matches the prescribed order, so that seems to be all good. Next thing I'm going to look at is your IV line. Do you have any pain or irritation around the IV line?
No.
Any swelling?
No.
All right, so I'm just going to take a look, make sure there's no swelling, there's no redness, and there isn't. It looks like it's working properly. And then I'm going to look at the line. There's no kinks. The fluid is moving, so that tells me it's working, and it does match the prescribed order. Next thing I'm going to look for is if there was a catheter, and on this patient we don't have one today, and if we did, we would assess it accordingly. All right? So the next thing I'm going to do is check your hair. I'm just going to take a look and make sure everything is good. So the hair is kept clean, just neat. I don't see any lesions on the scalp. There's no redness anywhere around the scalp. All right, so that looks good. Next thing I'm going to check is the skin. So overall, the skin looks normal. Checking bilaterally, upper and lower limbs. The temperature seems normal, it's warm. There are no visible lesions on the skin, no cuts, no redness. And then we're going to check for edema. I don't see any swelling in the hands. And then checking the lower limbs, there are no edema present. Next thing I'm gonna check is your nails. I'm just gonna have you give me your nails, and we're gonna check for capillary refill. And on the hands, it's less than 3 seconds, which is normal. And then I'm gonna check the feet, and that is also normal. And then I'm gonna check for skin turgor. So it snaps back rapidly on both sides, meaning it's normal. And that is all for the skin. Then we're gonna check your ears. And looking at your ears on both sides, they look normal. There's no discharge, there's no lesions, no redness, no skin breaks. Next thing, I'm going to look at your eyes, and looking at them, I'm going to take a look at your conjunctiva, and on both sides they're pink, no signs of anemia. Your sclera is white on both sides, which tells me that there's no signs of jaundice. And then I'm going to get my light over here. All right, and then I'm going to check for your pupils, and they're both equal, round, reactive to light and accommodation. So that is good. Next thing we're going to check for is the nose. And looking at your nose, it looks pink. There's no discharge. Do you have any drainage?
No.
No? All right. So the nerves are normal. Everything looks good. Next thing we're going to check is the mouth. And I'm going to have you open your mouth and stick your tongue out for me. All right. And then looking in your mouth, everything looks nice, moist, and pink. And with no deviation of the tongue, everything's normal. All right. So next thing, if you can give me a big old smile. All right. So the face looks symmetrical, and everything looks normal there as well. So the next thing we're going to do is assess your chest. Looking at the patient, the chest moves symmetrically. Do you have any shortness of breath?
No.
All right, so there's no shortness of breath, and there's no use of any accessory muscles. So that is a good sign. That tells me everything is normal for this patient. For the sake of this video, we're going to move our patient to this side of the bed. That way we can demonstrate how we're going to examine the patient posteriorly. All right, we have a good patient today. All right, so for the exam, we should have the patient remove the shirt. We should be assessing over the skin, and we'll begin. All right, so what I'm going to do is put this side or my stethoscope on your back in different places. Whenever you feel it, I want you to take a deep breath in and then out. All right? All right, so chest was clear, normal breath sounds on inhalation and or expiration and inspiration. If for the sake of the exam, we don't have a incentive spirometer. If we did, I would demonstrate on how to use it for the patient, and the patient would demonstrate back to me, and I would make sure that they have done it correctly. And that is all for today. Thank you.
Thank you.